So the 45th question is, which one of the following features are correct regarding the onset of the true labor? So first is regular uterine contraction. So this is correct. Progressive cervical dilatation and effacement. This is also correct. Presence of show. This is also correct. And then the labor and delivery are synonymous. No, delivery and labor are not synonymous. So labor and delivery are not synonymous. What is labor? So labor means, so what is labor? Labor means series of events that take place in the genital organs, in an effort to expel the viable product of conception, out of womb. So labor is basically series of events, while delivery is the expulsion or extraction of a viable fetus out of womb. So this is the expulsion or extraction of a viable fetus. So how can they both be different? So they both be different in the way that delivery can take place without even labor. So delivery is present, but labor is not present. When is it there? Whenever there is elective cesarean section. So in the elective cesarean section, there will not be any labor, while there will be delivery. So labor and delivery are not synonymous. So fourth is wrong. So the correct answer will be 1, 2 and 3. So A is the correct answer. So now these are the three features that they have provided for the true labors, but there are also other features of the true labor. What other features are? That there is increased frequency, that's the frequency of contractions increases gradually. Other than that, number 2, there will be descent of presenting part. So descent of presenting part is the feature of true labor. Presenting part is feature of true labor. Then the formation of bag of four waters is the feature of the true labor. Then it is not relieved by enema or sedatives. So these are the features of true labor. Now other than that, they can ask about the false labor as well. So false labor pain is dull in nature. Second is confined only to lower abdomen and groin. It is not associated with hardening of uterus, and it is usually relieved by enema or sedative. So this is about the true labor. Then coming to next question. According to WHO Intrapartum Care Guidelines 2018, the active phase of labor starts from what dilation of the cervix? So we have taken the PDF. We have taken this article from the PDF of the WHO Intrapartum Care Guidelines 2018. So in that, there's a recommendation number 5, which talks about the first stage of labor and definition of the latent and the active first stage of labor, which calls for the latent. So the use of the following definitions of the latent and active first stage of labor is recommended for the practice. The latent first is the period of time characterized by painful uterine contraction and variable changes of the cervix, including some degree of effacement and slower progression of dilatation up to 5 cm for the first and the subsequent labor. So answer is 5 cm. So it calls for the 5 cm. So according to WHO intrapartum care, the first stage of labor. So what is first stage of labor? So first stage of labor is the period between active uterine contraction or just painful uterine contraction, between uterine contraction to full dilatation of cervix, So this is known as the first stage of labor, which can be divided into latent phase or active stage. So latent stage means from the period from the uterine contraction to cervical dilatation up to 5 cm. And whenever the 5 cm cervical dilatation is achieved, it is the active stage. So less than 5 cm is the latent phase, and from 5 cm to full effacement, to full dilatation, will be the active stage of labor. So the first stage of labor is going to latent stage and the active stage. As per the WHO intrapartum care, latent stage is from the uterine contraction to less than 5 cm, and active stage is from 5 cm to the full dilatation. So this is about the WHO intrapartum care guideline number 2018. So it is the 5 cm. Now they can also ask you the ACOG guidelines. So we have taken from the website of ACOG what the ACOG calls. ACOG recommends that cervical dilatation of 6 cm be considered the start of the active phase of the labor. So as per the ACOG guidelines, the start of the active phase of labor is 6 cm. So according to the ACOG guideline, it is the 6 cm, while for the WHO guidelines it is the 5 cm.